PET scan. Positron emission tomography has been evaluated as an imaging approach in both primary and recurrent squamous cell carcinomas of the head and neck. F-fluorodeoxyglucose, I repeat, F-fluorodeoxyglucose or FDG is the most commonly used PET radioactive tracer. It enters the cell, undergoes the first step in glycolysis to produce FDG6-phosphate, and this reflects the metabolic rate of tissue. The metabolic rate of malignancy is higher than that of most benign tumors or normal tissues. FDG imaging therefore has the potential to distinguish between benign and malignant processes, grade tumors, identify metastases, and diagnose tumor recurrences. In head and neck cancer, FDG imaging is capable of detecting clinically occult recurrences and in determining residual disease in the neck following definitive radiotherapy. It has proved less useful in identifying an occult primary site in the setting of a patient with squamous cell carcinoma of an unknown primary site, as well as evaluating for distant metastasis disease if conventional imaging of the lung does not show distant spread. PET scan, positron emission tomography imaging, is currently most useful when registered with a CT scan, CT. What is the basis? The metabolic rate of malignancy is higher than that of most benign tumors or normal tissues. FDG imaging therefore has a potential to distinguish between benign and malignant processes. What is the basis? Fluorodeoxyglucose FDG is the most commonly used PET radiotracer. It enters the cell, undergoes the first step in glycolysis to produce FDG6-phosphate, which reflects the metabolic rate of tissues. The metabolic rate of malignancies being higher than that of most benign or normal tissues, it has the potential to distinguish between benign and malignant processes.